Hello, my name is Ranjeshni Garg and I'm a Nightingale student. Today I will be making a video on prenatal education precautions, and I'm wearing my Nightingale badge. I do not have my scrubs yet for Nightingale, so I'm wearing another scrubs today. So, talking about the foods to avoid during the pregnancy is unwashed or pre-cut fruits and vegetables, and that leads to a risk of listeriosis, which can lead to miscarriage. Taking uncooked meat and raw or either uncooked eggs, that can lead to toxoplasmosis, which can lead to fetal blindness and as well as brain damage, and it can also lead to salmonella poisoning, and which can cause miscarriage. Um, Also, taking unpasteurized dairy products, it can give potential exposure to harmful bacteria. Eating fish high in mercury can affect the baby's nervous system, and taking high doses of caffeine may lead to low weight and miscarriage. Also, taking over-the-counter medications such as before even taking it, you should consult your physician. Especially avoid during the first trimester. Any over-the-counter medications should be avoided during your first trimester of your pregnancy. Taking prenatal supplements such as folic acid and similar supplements are recommended to folic acid because it gives iron, and medications to avoid during pregnancy are teratogenic drugs that can cause severe birth defects and miscarriage. Some of the examples include epileptic medication, retinoid medication, ACE inhibitors, and as well as ARBs. And lithium and oral contraceptives, warfarin supplements. You should only be taking prenatal vitamins and supplements recommended by your healthcare provider only. For environmental exposure to avoid while being pregnant are extreme heat, example hot tubs and saunas, and because it can cause a neural tube defect. Cat litter boxes, it can risk of toxoplasmosis, leading to fetal blindness and as well as brain damage or stillbirth. Radiation, it can cause a high dose of x-ray can lead to miscarriages, and lead found in old paint can cause developmental issues. Substance to avoid is alcohol. It can cause a fetal alcohol syndrome, leading to growth abnormalities and mental disabilities, and as well as abnormal facial features. Tobacco smoking, it contains harmful chemicals, both nicotine as well, which can cause permanent lung and brain damage to the baby, and increase the mother's risk of bleeding. The leads to low birth defect, the leads to low birth weight and respiratory issues. Substance abuse can cause placental complications, severe birth defects, and neonatal withdrawal. Travel precautions to take is always consult with your physician for long distance traveling. Prolonged sitting can lead to DVT, which is deep vein thrombosis in a lower extremities of your legs. And tips to avoid DVT are: get up and walk frequently, wear compression socks, and stretch and move your legs and ankles regularly. And the safest time for travel is during the second trimester, which is between 14 to 28 weeks. And some of the precautions for traveling are: know your blood type if something happens in emergency, and avoid certain vaccines such as typhoid. Stay away from tropical islands or developing countries to reduce exposure to the Zika virus. And you should always stay hydrated, wear seat belts, and take frequent breaks while traveling. Dental care during pregnancy. Seeing a dentist during pregnancy is highly recommended due to the hormonal changes that can increase the risk of dental issues and cavities. The best time for dental visits are during the second trimester, as lying on your back for long period should be avoided in the third trimester. The safest dental procedure includes filling, crowns, and anesthesia with epinephrine. And you should always avoid x-rays during your pregnancy, because it's not safe for the baby. And thank you, and this was my video for the prenatal education precautions. Thank you.